Welcome to Dietitian Academy, your shortcut to cracking dietitian exam. Hi everyone, I am Mohammad Shoaib, a certified dietitian with bachelor's and master's degree in nutrition and dietetics. I recently cracked AIIMS CRE Dietitian Exam with All India 4th rank in my first attempt, and now I am here to help you succeed in this RRB Dietitian Exam, which is going to be conducted in this month. On Dietitian Academy, I will be uploading 70 most predicted MCQs questions daily, focusing purely on exam relevant questions without going deep into the theory because the time is short. If you find this session helpful, I will also start topic-wise classes and provide notes for the future government dietitian exam. So subscribe now, stay consistent, and let's crack this exam together. Let's start with first question. Which of the following is the primary function of the mitochondria in the human cell? Protein synthesis, energy production, DNA replication, hormone secretion. As everyone knows, mitochondria is the powerhouse of the cell which produces ATP, which is nothing but energy. So the answer will be B, energy production. Second question, the human circulatory system primarily transports which of the following? Oxygen and nutrients, digestive enzymes, neural impulses, bone marrow. Blood carries nutrients and oxygen. Okay. Hemoglobin is present in the blood, which helps you to carry the oxygen. So the answer will be A, oxygen and nutrients. Third questions. The process by which the body maintains a stable internal environment is known as homeostasis, metabolism, adaptation, equilibrium. So the answer will be A. Homeostasis is nothing but maintain the normal internal temperature and normal environment in the body. Fourth question. Which organ is primarily responsible for filtering waste products from the blood? Heart, liver, kidney, lungs. So heart is used to pump the blood, liver is for detoxification, so kidney is helpful for filtration, lungs is for the oxygen transport. Let's go for the fifth question. The central nervous system consists of which two major components? A, brain and spinal cord, B, brain and peripheral nervous, C, spinal cord and sensory organs, D, peripheral nerves and ganglia. So the central nervous system consists of brain and the spinal cord. So the answer will be A. Sixth question. Which vitamin is essential for calcium absorption in the body? A, vitamin C, B, vitamin A, C, vitamin D, D, vitamin K. The answer will be C. Vitamin D is essential for the calcium absorption in the intestine. In the presence of vitamin D, the calcium is absorbed. Question 7. Proteins are primarily made up of which type of biomolecule? A, amino acids, B, fatty acids, C, nucleotides, D, monosaccharides. Amino acids together form protein. So the answer will be A, amino acids. So we'll start with 8th question. Which of the following is a function of dietary fiber? A, increases blood sugar, B, enhances digestion, C, lowers vitamin absorption, D, increases fat deposition. So dietary fibers are helpful in digestion by preventing constipation and also helping in blood sugar management. So the answer will be B. So 9th question. Omega-3 fatty acids are most commonly associated with which health benefits? A, improved skin hydration, B, enhanced cognitive function, C, better cardiovascular health, D, increased muscle mass. Omega-3 fatty acids contains EPA and DHA, which are helpful in cognitive development in elderly and in children. So the answer will be enhanced cognitive functions. 10th question. Which mineral is essential for oxygen transport in the blood? A, calcium, B, magnesium, C, iron, D, zinc. So hemoglobin contains iron in that, which helps in oxygen transport in the body. So the answer will be C, iron. 11th question. The recommended dietary allowance is primarily designed to A. Provide maximum nutrient levels. B. Prevent nutrient deficiencies. C. Cure diseases. D. Support athletic performance. So the answer will be B. Prevent nutrient deficiencies. 12th question. Which of the following macronutrient is the main source of energy for the body? A. Protein. B. Carbohydrate. C. Vitamins. D. Minerals. So answer will be B. Carbohydrate provides energy to the body. It contains 4 kilocalories per 1 gram of carbohydrate. 13th question. A balanced diet typically includes adequate amount of A. Carbohydrate, fats and proteins. B. Fats, sugar and sodium. C. Water, fiber and alcohol. D. Vitamins, pesticides and additives. So the answer will be A. As you know, the macronutrients are carbohydrate, protein and fats. So the answer will be A. 14th question. Which of the following is not considered as essential nutrient? Carbohydrate, fiber, water, artificial sweeteners. Carbohydrate is considered of macronutrient which is essential. Fiber is also considered essential due to digestion for the benefits of digestion. Water is important for the body. And artificial sweeteners are not essential for the body. So the answer will be D. 15th question. The term calorie density refers to the amount of calories per serving, the weight of food item, the volume of food consumed, the nutrient absorption rate. Calorie density means the amount of per serving, how much amount of calories are we getting is called calorie density. 16th question. Antioxidants in the diet primarily functions to. 16th question. Antioxidant in the diet primarily functions to enhance flavor, protect cell from free radicals, increase calorie content, promote protein synthesis. The answer will be B. Protect cells from free radicals. So antioxidants are helpful to reduce the free radicals and decrease the oxidative stress. 17th question. The glycemic index of food indicates the vitamin content, the effect on blood sugar levels, the protein quality, the fat composition. So the answer will be B. The effect on blood sugar levels. 18th question. Which of the following is a key factor in advanced nutritional therapy for chronic diseases? A. The high protein intake. B. Personalized nutrition plan. C. Uniform diet for all. D. Avoidance of all fats. So the answer will be B. Personalized nutrition plans. So in nutrition therapy for the chronic diseases, creating a personalized plan for the individual is the choice. So 19th question. In the nutritional research, bioavailability refers to the storage capacity of nutrients, the proportion of nutrients absorbed and utilized, the caloric value of nutrient, the taste and texture of the food. Here the answer will be B. The proportion of a nutrient absorbed and utilized in the body. Bioavailability is nothing but the amount of nutrients are absorbed and utilized in the body. 20th question. Functional foods are best described as the food with no nutritional values, foods enhanced with additional health benefits, foods that only provide basic energy, foods used only for medical nutrition therapy. So the answer will be B. The foods enhanced with additional health benefits. So functional foods are nothing but the foods which gives additional health benefits when consumed. 21st question. Nutraceuticals are best defined as A. The pharmaceuticals derived from synthetic chemicals. Foods are supplements that provide health benefits beyond basic nutrition. Processed foods with no nutritional benefits. Natural remedies that replace all medication. So the answer will be B. The foods of supplements that provide health benefits beyond basic nutrition. Nutraceuticals are made up of both nutrients and pharmaceuticals. 22nd question. Which of the following is commonly marketed as nutraceuticals? A. Aspirin. B. Probiotic yogurt. C. Refined sugar. D. White bread. So the answer will be B. Probiotic yogurt. Probiotic yogurt is also considered as nutraceutical because it helps in increasing gut microbiota, good digestion. 23rd question. Bioactive compounds in nutraceuticals are known to A. Increase calorie content, B. Prevent oxidative stress, C. Replace dietary fiber, D. Enhance food color. So the bioactive compounds are helpful in preventing oxidative stress. So the answer will be B. 24th question. The term nutraceuticals is a combination of which two words? A. The nutrition and chemicals, B. Nutrition and pharmaceuticals, C. Nutrition and technical, D. Nutrients and factory. So the answer will be B. Nutrition and pharmaceuticals together is called as nutraceuticals. 25th question. Which of the following is an example of nutraceutical ingredient? A. Omega-3 fatty acids, B. Artificial colors, C. Trans fat, D. Preservatives. Here the answer will be A. Omega-3 fatty acids are considered as nutraceuticals due to their cognitive benefits. 26th question. In dietary therapy, a low sodium diet is most beneficial for patients with hypertension, anemia, diabetes, and osteoporosis. So the answer will be A. In hypertensive patients, consuming low sodium diet helps in maintaining of blood pressure. 27th question. The ketogenic diet is primarily used in management of A. Epilepsy, B. Hypothyroidism, C. Hypertension, D. Renal failure. So the answer will be A. So the ketogenic diet is mainly used to treat epilepsy patients, in children especially. 28th question. For patients with lactose intolerance, which dietary modification is recommended? A. Increased dietary consumption, B. Lactose-free alternative, high sugar diet, D. Gluten elimination. So the answer will be B. Lactose-free alternatives. So in lactose intolerance patients has a deficiency of lactase enzyme. So they are impaired to digest the lactose sugar. So providing them lactose-free alternatives will help in their dietary modification. 29th question. A diet low in food maps is often recommended for individuals with A. Irritable bowel syndrome, which is called IBS, B. Heart diseases, C. Osteoarthritis, D. Hypertension. Here the answer will be A. Food maps are nothing but foods that contains oligosaccharide, monosaccharide, and fermented foods, which will cause irritation in the gut. So the answer will be A. Irritable bowel syndrome. 30th question. In the context of diet therapy, what is the main purpose of an elimination diet? A. To boost calorie intake, to identify food allergies or intolerance, to reduce water retention, to enhance muscle growth. So the answer will be B. To identify food allergies or intolerance. So the elimination diet is nothing but removing or eliminating the allergic food or intolerance food, which is called elimination diet. So the answer will be to identify food allergies or intolerance. 31st question. Clinical nutrition primarily deals with A. Cooking techniques, B. Nutritional management of diseases, C. Exercise regime, psychological counseling. So the answer will be B. Nutritional management of the diseases. So clinical nutrition deals with management of diseases. 32 question. Enteral nutrition refers to A. Intravenous feeding, B. Feeding through gastrointestinal tract, C. Oral supplement only, D. Topical nutrient application. So the answer will be B. Feeding through the gastrointestinal tract. Enteral nutrition is nothing but tube feeding, where we send the food through tube to the gastrointestinal tract. Intravenous feeding is nothing but parenteral nutrition. Intravenous feeding is called parenteral nutrition, where the food is sent in intravenously. 33rd question. Parenteral nutrition is delivered via, as I discussed before question, the parenteral nutrition is delivered through intravenous infusion. 34th question. Which of the following is a key component in assessing a patient's nutritional status? A. Blood pressure only, B. Anthropometric measurements, C. Dietary preference only, D. Family history alone. So the answer will be B. Anthropometric. In the patient assessment, we take anthropometric measurements like weight, age, height, etc. and start evaluating the nutritional status of the person or patient. 35th question. The nutritional risk screening tool is used to NRS. A. diagnose infectious diseases. B. Evaluate the risk of malnutrition in the patients. C. Determine exercise capacity. D. Monitor liver function. So the answer will be B. Evaluate the risk of malnutrition in the patients. So the nutrition risk screening tool is used to identify the malnourished patient or malnutrient patient. 36th question. Which of the following is considered as whole grains? A. White rice. B. Refined white flour. C. Oats. D. Corn syrup. Here the answer will be oats, because white rice doesn't have fiber and protein in that. In refined white flour, the fiber is taken out. So the oats contain fiber and nutrients in that. So we consider as whole grain. 37th question. The term umami refers to which aspect of food? A. Sour taste. B. Sweet taste. C. Bitter taste. D. Savory taste. So the word umami is derived from Japanese language, where they called umai as five sense of taste, like sweet, sour, and bitter. So they use this for the savory taste. Umai is nothing but savory taste. 38th question. Which cooking method is considered one of the healthiest due to minimal use of fats? A. Deep frying. B. Steaming. C. Grilling. D. Baking with added butter. So here the answer will be steaming. Steaming helps in minimal use of fats in that, so it considered as more healthier option than the other cooking method. 39th question. The process of fermentation in food production is primarily used to A. Increase shelf life and enhance flavor. B. Remove all bacteria, reduce nutrient content. D. Increase fat content. So here the answer will be A. Increases shelf life and enhance flavor. So fermentation of food helps in increasing the shelf life and enhancing the flavor. 40th question. Which nutrient is most likely to be affected by prolonged cooking in water? A. Fats. B. Protein. C. Vitamin C. D. Carbohydrate. Here the answer will be vitamin C. Vitamin C is very sensitive to the heat. So if there is a prolonged cooking in the water, there is a loss of vitamin C. 41 question. Lactic acid bacteria are commonly used in production of A. Cheese and yogurt. B. Bread and pastries. C. Meat and poultry. D. Oils and fat. So as everyone knows, lactic acid bacteria is helpful in production of cheese and yogurt. Question number 42. The main purpose of pasteurization is to A. Enhance flavor. B. Destroy harmful microorganisms. C. Increase nutrient density. D. Add color to food. Here the answer will be B. The pasteurization is a process where the food is heated at 71 degree Celsius for 15 seconds and along with the rapid cool down. Where it inhibits the harmful microorganisms. 43rd question. Which microorganisms is primarily responsible for fermentation of beer? A. Lactobacillus. B. Saccharomyces cerevisiae. C. Escherichia coli. D. Clostridium botulinum. So here the answer will be B. Saccharomyces cerevisiae. The Saccharomyces cerevisiae is nothing but yeast, which we use in bread and fermentation process. Question number 44. Antibiotic resistance in bacteria is often due to A. Overuse of antibiotics. B. Lack of vitamins. C. Insufficient sleep. D. High fiber diet. Here the answer will be A. Overuse of antibiotic. Overuse of antibiotic for a long time will cause resistance in the bacteria. So the antibiotic will not work if we taken for the longer time. So it forms resistance to that. Question number 45. Which of the following is an example of foodborne pathogen? A. Streptococcus aureus. B. Saccharomyces cerevisiae. C. Lactobacillus acidophilus. D. Bifidobacterium bifidum. Here the answer will be A. Staphylococcus aureus. The other options are Saccharomyces cerevisiae is nothing but yeast, which is used in fermentation process. The lactobacillus and bifidobacterium are helpful in yogurt production. So the answer will be A. Staphylococcus aureus. Question number 46. In nutritional management, which of the following is critical in preventing chronic diseases? A. High caloric diet. B. Balanced nutrient intake, eliminating all fats. D. Excessive protein consumption. In the nutrition management therapy, we use balanced nutrient intake. So the answer will be B. Balanced nutrient intake for the normal functioning of the body and to prevent chronic diseases. Question number 47. The Mediterranean diet is primarily associated with A. Increased processed food consumption. B. Reduced cardiovascular risk. C. High saturated fat intake. D. Low fiber intake. So the Mediterranean diet is primarily associated with the monounsaturated fatty acids. So these monounsaturated fatty acids are helpful in reducing cardiovascular risk. Question number 48. Dietary modification for type 2 diabetes management usually emphasize A. High simple sugar. B. Low glycemic index food. C. Excessive sodium intake. D. High saturated fat intake. In type 2 diabetes, there is insulin resistance in the body. So providing low glycemic index food helps in managing blood sugar levels. So the answer will be B. Question number 49. Anti-inflammatory diet typically includes increased amount of A. Refined carbohydrate, B. Omega-3 fatty acid, C. Trans fat, D. Processed meat. So here the answer will be B. Omega-3 fatty acids helps in anti-inflammatory properties, reducing anti-inflammatory properties. So omega-3 is considered as so usually omega-3 is increased in anti-inflammatory diet. Question number 50. Which of the following lifestyle modification is commonly recommended alongside dietary changes for weight management? A. Increased sedentary behavior. B. Regular physical activity. C. Skipping meals. D. High alcohol consumption. So the answer will be B. Regular physical activity. In weight management, a person need to be physically more active to lose weight and follow a calorie deficit diet. So in these cases, the answer will be B. Regular physical activity to maintain the weight. So question number 51. The primary role of enzyme in nutritional biochemistry is to A. Store energy, catalyze biochemical reactions, C. Transport nutrients, D. Provide structural support. So the term enzyme in nutritional biochemistry, enzymes acts as catalase in the chemical reactions. So the answer will be B. Catalyze biochemical reactions in the body. Question number 52. Which molecule is known as the energy currency of the cell? A. ATP, B. DNA, C. Glucose, D. Protein. So the energy currency is nothing but ATP, adenosine triphosphate, which is produced in mitochondria of the cell. So the energy currency of the body is ATP. Question number 53. Lipoproteins are complexes that transport A. Vitamins only, B. Lipids in the blood, C. Carbohydrate exclusively, D. Amino acids in muscle tissue. So lipoprotein is nothing but protein layer is covered on the fatty acid. This is a fatty acid. There is small layer covered which is called bile protein, which will help in transportation of lipids in the blood, because lipids are not permeable to the membrane, so it needs protein to travel. So the answer will be B. Lipids in the blood. Question number 58. The process of beta oxidation is associated with metabolism of A. Carbohydrate, B. Protein, C. Fatty acids, D. Vitamins. So here the answer will be C. Fatty acids. The beta oxidation will occur in mitochondria, where the fatty acids are oxidized and produce energy. So the answer will be fatty acids. Question number 55. Which vitamin acts as a coenzyme in various metabolic reactions? A. Vitamin D, B. Vitamin B6, C. Vitamin E, D. Vitamin K. Here the vitamins D, E, K are fat soluble. So the answer will be B. vitamin B6, which helps as a coenzyme in various metabolic reactions. Not only B6, all B complex vitamins usually help in metabolic reactions. Question number 56. In research, the term p-value is used to A. Measure sample size, B. Determine statistical significance, C. Calculate mean value, D. Define research hypothesis. If the p-value is less than 0.05, then we consider it is as a statistical significance. If the p-value is greater than 0.05, it is not statistical significance. So the answer will be B. For this topic, for the p-value, I will be explaining in the further later sessions. Question number 56. A randomized controlled trial is considered the gold standard for A. Observational studies, B. Experimental research, C. Case report, D. Historical analysis. So here the answer will be B. Experimental research. The randomized control trial is considered as gold standard because it eliminates bias or mistakes. Select the participant randomly, so there is very less bias in that. So the answer will be experimental research. Question number 58. Which of the following statistical test is used to compare means between two groups? A. Chi-square test, B. T-test, C. Regression analysis, D. ANOVA. So here the answer will be T-test. T-test is nothing but comparing the means of two groups. Chi-square test is usually used for comparison of category. Regression analysis is prediction. ANOVA is used to compare more than two or three means in a group. So here the answer will be T-test. 59 question. In nutritional research, a confidence interval provides information about A. The variability of sample, B. The precision of an estimate effect, C. The total sample size, D. The survey method used. In confidence interval research which we conducted are confident that they will lie in this category. For example, if there is 1 to 10 number, so they are confident that the research which they have conducted, the information will lie between 1 to 5. So they are confident on that. So the answer will be B. The precision of an estimated effect. Question number 60. The p-value less than 0.05 in the study typically indicates. So as I mentioned in the above questions, the p-value less than 0.05 is considered as a statistical significant result. 0.05. If the p-value is greater than 0.05, then it is not considered as a significant difference. So question number 61. Medical nutrition therapy is primarily used to A. Management athletic performance, B. Treat and manage chronic diseases, C. Replace all forms of medications, D. Increase food variety. So here the answer will be B. Treat and manage chronic diseases. In medical nutrition therapy, we usually manage chronic diseases. Question number 62. In managing diabetes, which of the following is a key diet recommendation? A. High intake of refined carbohydrates, B. Monitoring carbohydrate intake, C. Avoiding all forms of sugar, D. High fat, low fiber diet. Here the answer will be B. Monitoring carbohydrate intake, because in managing diabetic, monitoring the carbohydrates are very important to maintain blood sugar levels. So the answer will be B. Question number 63. A key goal of medical nutrition management in renal disease is to A. Increase protein intake drastically, B. Limit sodium and potassium intake, C. Eliminate all carbohydrate, D. Enhance vitamin D absorption. Here the answer will be B. Limit sodium and potassium intake, because sodium causes water retention and potassium if kidney in renal diseases there is impaired loss of potassium where it accumulate and causes hyperkalemia. So to prevent hyperkalemia, we limit sodium and potassium intake. Question number 64. In metabolic syndrome, which of the following is typically observed? A. Low blood pressure. B. High blood glucose. C. Reduced lipid levels. Decreased waist circumference. So here the answer will be B. High blood glucose. In metabolic syndrome is nothing but obesity, where there is a high blood pressure, high blood glucose levels, high fat, dietary lipids. So the answer will be high blood glucose level. Question number 65. Insulin resistance is a hallmark of A. Type 1 diabetes, B. Type 2 diabetes, C. Hypothyroidism, D. Anemia. So the insulin resistance is hallmark of type 2 diabetes. Question number 66. Cachexia in chronic diseases is primarily recognized by A. Muscle wasting, B. Increased fat storage, C. Bone growth, D. Enhanced appetite. Cachexia is nothing but losing muscle and body fat, muscle wasting. In cachexia, there is a high catabolism where your body will lose fat, muscle density. Question number 67. Public nutrition programs often focus on A. Individualized dietary counseling, B. Community-wide nutritional education, C. Exclusive use of supplements, high cost personalized diet. So when it comes to public nutrition, community-wide nutritional education is feasible. So the answer will be B. Question number 68. In pediatric nutrition, which nutrient is most critical for growth and development? A. Calcium, B. Protein, C. Vitamin B12, D. Fiber. So in pediatric nutrition, where the child is in growth phase, providing high protein will help in growth and development. So the answer will be B. Question number 69. The primary treatment for a severe food allergy reaction is A. Antihistamines only, B. Avoidance of allergen, C. Epinephrine injection, D. Increased calorie intake. In severe food allergic reaction, we also call it anaphylaxis. Here we use epinephrine injection for immediate treatment. So the answer will be C. Question number 70. An elimination diet is commonly used to A. Diagnose food allergy, B. Increase metabolic rate, C. Enhance taste, D. Boost energy levels. So the answer will be A. The elimination diet is used to identify the food allergies. So that's all for today.